Hello everyone, my name is Jennifer Dos Santos and today I will be talking to you about the supervision of licensed clinicians and medical professionals by someone with a bachelor's in health services administration. Let me begin by apologizing that I'm not there in person, but I hope you enjoy my presentation. I will start by taking a look at the definition and history of health services administration. Health Services Administration is a field in healthcare that is often overlooked but is very important. When people hear healthcare, they usually think doctor, nurse, surgeon, or paramedic. As healthcare administrators, we are the ones who will be working behind the scenes, controlling patient records, the politics within the surrounding hospital, the finances, and so much more. In our textbook, management is defined as the process comprised of social and technical functions and activities occurring within organizations for the purpose of accomplishing predetermined objectives through human and other resources, basically meaning that managers work through and with others to accomplish goals that are beneficial for the organization. Up until the 1800s, hospitals offered very little to basically no support for the sick patients. There just wasn't enough money nor enough knowledge for medical treatment to provide any. This all changed as medicine progressed, modern surgery and anesthesia became reality, and medical tools advanced in the early 20th century. With the advancement, hospitals began to open their doors to the sick, now properly prepped with the tools and knowledge to help them. As more hospitals opened, it became more and more apparent that some type of training program had to be offered to assist those individuals who were to manage and assume administrative responsibilities within the hospitals. So the modern day health systems management program was started in 1934 at the University of Chicago. This program offered by the University of Chicago was the first to offer a master's degree in healthcare administration. The program required 1 year of coursework and 1 year of practical work experience. Later on, this turned into a 2 year coursework graduate program model that was graduate schools still follow today. The healthcare system is booming, and health administration careers are keeping pace. According to the Bureau of Labor Statistics, those in healthcare administration can expect job growth of 23% from 2012 to 2022, which is much higher than the average for all occupations. Much of this growth is expected to stem from a healthcare system that will see increased demand from an aging baby boomer population, as well as technology that allows patients to live longer lives. This demand will mean more hospitals, clinics, physicians, and other healthcare professionals are needed. That means more health administrators will be called upon to make sure everything runs smoothly. Now, what does a healthcare administrator do? Within a healthcare organization, there are many positions for a BHSA student, and not all are at the top of the level. Positions exist at lower, middle, and upper levels. Within these levels, authority is delegated downwards, so lower level managers have less authority than higher level managers. The higher level managers have a much larger scope of responsibility. The day to day of a healthcare administrator varies depending on which organization they work for, but the essential core of the job remains the same. Overall, a health services administrator is responsible for making sure that the overall operations in the hospital system, or healthcare organization runs smoothly. An individual with a health services administration degree might work out of a large health company or hospital system where they would oversee several facilities at once, or they might work at a smaller scale, such as managing a group of medical practices, a specific department with a hospital system, or a single medical practice. Job duties can include wide range planning and coordination and implementation of medical healthcare services, deep understanding of healthcare policy and laws, as well as current and upcoming issues that require we stay ahead of the curve, attending and participating in meetings with investors to the organization and governing boards, supervising assistant administrators, making sure that there is open communication between medical staff and the heads of departments, working not only to improve the overall efficiency of the staff and policies, but working on always improving financial effectiveness. And of course, the smaller details of staff scheduling, hiring, and salary issues, patient fees and billing, and even keeping an inventory of supplies. The bachelor's degree in health administration or closely related field is typically the minimum required for an entry-level position, but you should keep in mind that BHSA is not made qualified enough for higher positions, so chances of advancement may be limited. The most common educational path for those who would like to reach upper management is a master's degree in health services administration. Apart from the degree, it is helpful to have experience in the medical field as well. I myself work in a healthcare organization known as Chum Medical Center in South Florida, Dedicated Senior Medical Center in Central Florida, and Gen Care outside of Florida. Working in this environment, you get firsthand experience as to how healthcare administrators are needed. Within the offices, you see a center manager, an assistant manager, a medical assistant team lead, and at different times, you may see the operations director who manages a number of locations, or the network director who manages the list of specialists and facilities that we work with. Now, for the most part, the positions I mentioned may or may not have degrees in healthcare administration. The field itself has grown only recently. But I have noticed that the higher you go in the chain of command, the higher the degree, and more often than not, more likely it is that the individual has some kind of clinical degree, MD, RN, PhD, just to name a few. From this and conversations I've had with many in the field, I've learned that it is more than beneficial to substantiate your degree with some kind of clinical degree. So, how do clinicians feel about health services administrators who are in those supervisory roles but may not have clinical degrees? Within my company, it ultimately comes down to the effectiveness of the team. I know the medical directors have the final say perhaps when it comes to approving an authorization, but they need to take input of all those involved, including the lowest of the administrative chain, me, the referral coordinator, because at the end of it all, I am the one who sees the patient outside of the patient room. I read a study that stated that some clinicians and administrators were not as in sync as my company because sometimes the clinicians felt the administrators were not taking into account that they need time to see the patients and would rather leave administrative meetings for before or after office hours. Overall, they all felt that they missed some lack of communication and teamwork. So what can be learned from this? The BHSA is a degree that has recently become more known. Regardless of where you want to end up, with it, you should always keep in mind that you have a lot of options, but you have to be a team player. No matter where you go, your job is to keep the organization running smoothly, and in order to do so, you must know how to lead those around you and work with them so that the organization can continue to grow and so that the patients are happy. You must always know how to properly take care of those who take care of others.